Hey there, I'm Joel Olivia by name, and in this video we'll be talking about myocardial infarction, or what we popularly know as heart attack. We'll be looking at the definition, the risk factors, the pathophysiology, and the symptoms, the signs and symptoms. We'll also look at the medical management, the diagnosis, and the nursing care rendered to patients with myocardial infarction. Now, myocardial infarction, if you look at the two words, if you break them into two, you have myocardia, which is the myocardium, and we have infarction. The myocardium is the heart muscle, the middle layer of the heart, while we have infarction, which means death, tissue death. So, myocardial infarction is the death of the myocardium, or you say necrosis of the myocardium, as a result of occlusion, that is total blockage of the coronary arteries which supplies blood to the heart, meaning that there is insufficient oxygen supply or blood supply to the heart muscle. Now, this myocardial infarction most likely is going to be regional, that is going to be localized. Sometimes you have myocardial infarction build up at different portions of the heart, but majorly it is localized at maybe one region of the heart and the likes. Now, what are the risk factors that trigger this condition? We have atherosclerosis, meaning fat deposition at the coronary artery. We also have coronary artery diseases. We have increase in blood level of cholesterol, that is cholesterol blood level, could also cause it or trigger it. Smoking, hypertensive disorder, and obesity. Obesity, where there's excess fat in the body, and some of this fat could go and lodge at the coronary artery. Now, the pathophysiology, how does this disease comes about? First of all, let's take for example, this is the coronary artery supplying the heart. You discover that there's deposition and build-up of a plaque. That plaque could be fat droplets, and those fat droplets deposit at this point and build up. Over time, they begin to build up and grow, and there is partial occlusion, which, if not watched out for, becomes much and grows more like that. Then what happens next? You have rupture of the plaque, meaning that at a point in time, this plaque ruptures, and the body now sees it as an inflammation. The body sees this ruptured portion as a foreign body or a foreign occurrence, and immediately there is a reaction which we call inflammation, and at that point clot formation takes place. So in order to seal up this plaque or this portion, the body releases platelets, and they come to this point and begin to cover the part that was ruptured. And after the clot formation, the part becomes occluded the more, the artery becomes occluded the more, leading to reduced oxygen supply or blood supply to that portion. That leads us to myocardial hypoxia, low supply of oxygen to the myocardium, or you can say myocardial ischemia, meaning poor blood supply to the tissue of the myocardium. Now, after subsequent periods of time, if not treated, it leads to necrosis. Since there is no blood supply or oxygen supply to the heart muscle, the heart tissue of the heart muscle at that part dies off, and that's what we call necrosis. This happens 6 hours after the hypoxia. If not treated, or if there is no intervention, you have scar tissue. The body tries to seal off this tissue death and becomes scar tissue. This scarification takes place within 2 to 3 months of necrosis. So that's it about the pathophysiology of the heart. The next we'll be looking at is the diagnosis and the medical management and nursing management of myocardial infarction. We'll be looking at the diagnosis of myocardial infarction. Now, the first thing that happens that we can do is to check for the biomarkers, the cardiac biomarkers. There we have increased troponin levels, and we'll also discover increased creatine kinase myoglobins, which is a protein that usually increases during myocardial infarction. Also, there will be increased white blood cells. Now, ECG reading is likely to show either ST elevation, diastema, or non-ST elevation myocardial infarction. Another ECG reading could also show T-wave inversion. Now, for the video on ECG readings, normal ECG readings, you can check this link below to watch it out. Now, we are going to look at the signs and symptoms. One of the signs and symptoms in myocardial infarction include crushing pain. In fact, the pain is so severe that the person could go into fainting attack, and the pain lasts for a very long time, for about 30 minutes. We also have diaphoresis, that's excessive sweating. We also have dyspnea. We also have anxiety, pallor, and other signs and symptoms. Now, for the medical management, majorly drugs are using both IV, it could be IV, it could be oral, or it could be sublingual, like in the case of nitroglycerin. Nitroglycerin is a vasodilator which relaxes the blood vessels and increases blood supply to the heart muscle. Aspirin, on the other hand, dissolves the platelet agglutination, or the aggregation of platelets. So, aspirin dissolves a collection of platelets, or the clot that has been formed. Also, morphine is given as the analgesic of choice. It's an opioid analgesic, and it's needed for this condition. Then IV beta blockers like propranolol, atenolol. These blockers are given to reduce the oxygen consumption by the myocardium of the heart. Then antiarrhythmics could also be given, like amiodarone. This tries to stabilize heart breathing. Now, there are some other surgical interventions that could also occur. Nursing care regarding myocardial infarction. First of all, you assess the nature of the pain. You listen to the patient, hear from the patient. Then also you assess the vital signs. You monitor the vital signs on a regular basis to check for abnormalities in vital signs. Administer oxygen, 2 to 4 liters of oxygen. You provide bed rest. These patients usually require a lot of bed rest. Then also you place patients on a semi-fowler position, where the patient sits in a semi-position with the knees flexed. Then you monitor for complications like dysrhythmias could occur as a result of myocardial infarction. Then also health education. In the patient's diet, there should be low sodium, there should be low cholesterol, there should be low fatty diet. Then also there should be low stress. Also, certain lifestyle activities like smoking should stop. It is not recommended at all. So with this, we've come to the end of myocardial infarction. I want to thank you for listening, and please urge you to subscribe below for more videos on these types of lectures. Thank you.